This is Bianca Martinez, and I'm going to be doing my video on how to care for a tracheostomy by cleaning it and sectioning the tracheostomy. We are going to begin by performing hand hygiene. As we enter the patient's room, we're going to make sure we knock and close the curtain to provide privacy. Once we have done hand hygiene and close the curtain, we are going to introduce ourselves to the patient. We are going to ask for 2 different identifiers, being their name and date of birth. Once we have confirmed that we have the correct patient, we are going to let them know what we are there to do. Hi, my name is Bianca, and I'm here to help clean your tracheostomy and how to suction it out to make sure there's no secretion stuck in there. Once we have let them know, we are going to go ahead and pull up the side table, put in all the equipment necessary on there and prepared. We are going to have the patient, if the patient is sitting up, we're going to turn up their oxygen. So they're going to be pre-oxygenated before we do the procedure. These procedures are sterile, so you want to ensure that you do not break your sterile field once you put on your sterile gloves. I'm going to verbalize that this is my sterile water. And with the equipment that they used on the video, they had a little section where they were able to pour it. So I'm just going to verbalize that I'm pouring my sterile water into the kit, and I'm going to ensure that I do not recap the sterile water. I'm going to begin by putting on my sterile gloves. I'm going to begin by cleaning out the cannula. I'm just going to verbalize that I'm taking it out. I used a long straw to demonstrate the tracheostomy. So to clean the cannula, some of them are reusable. That it may be a permanent one, it's more of a metal material, and others are just replaceable, that you would just enter a new one. But if it's one that has to go back into the patient, we are going to remove it by unlocking it, depending on what kind of lock the facilities use for the tracheostomy. Once we pulled it out, using the cleaning brush and with the sterile water that we poured into the kit, we are going to clean the cannula inside of it and on the outside. Once we have properly cleaned it, we are going to insert it back into the patient until it locks into the correct place. Cleaning the tracheostomy, you want to make sure you're taking off the old dressing around it, disposing it. And to ensure you're cleaning it properly, you want to clean around the whole tracheostomy, even under the stoma, to ensure that you're preventing any infections. I would use different Q-tips, or depending on what we have into our kit. Right now we have Q-tips, so I'm just going to verbalize that these are what clean the areas for us. Using a different one, ensuring you go under it in a circular motion. We are going to get a piece of gauze and pat dry. You want to make sure you're pat drying even under the area before you put a new dressing, to prevent from it getting any liquid that may fall out of there or secretion, so it doesn't wet the patient. You're going to put in a new one. And depending how your facility is, I would just initial it and the date you changed it. And that is my video for cleaning a tracheostomy.